First of all, I would like to thank you, Alison, and all the organizers for the invitation. I'm very, very pleased and delighted to be here with you. My name is Marco Crimi, and I'm serving as a scientific coordinator for Ring14 International. I have about 15 slides. I would like to provide you an overview of what we did in the last years. I hope we have enough time, otherwise please feel free to ask me to go faster if you don't have enough time. I hope you can appreciate how many touching points there are between our organization during my presentation, and I hope in the next future we will have other opportunities for collaborations. Okay, I'm a scientist. I'm not a parent of children affected by rare disease. I'm a scientist always interested on genetic rare diseases. And I'm also attracted by genomics and technology tools applied to genetic studies. So I'm very excited also to visit the Illumina facility tomorrow. And more recently, I'm also started to explore health digital solutions. And I have developed a true telemedicine system. The first one is called NetMedical, is a real telemedicine solution. And more recent, we have developed Genome Access, that is a digital system to provide genetic counseling. Okay, probably I don't have to spend too much time on these slides. Ring14 and Ring20, they share most of the most important symptoms. Of course, epilepsy is the worst clinical aspect. More than 80% of our children, they developed seizures, and probably one of the most important issues are children who can't respond to the standard anti-epilepsy therapies. And it is a very important problem for us, and I think it's the same for Ring20 also. So Ring14 International was launched on 2014, starting from the collaboration of two chapters, the Ring14 Italy and the USA chapter. So Ring14 International is a second level organization, an umbrella organization coordinating all the local chapters that are belonging to Ring14 International so far. Locally, we raise funds, and those funds are managed at a central level to coordinate the most important activities for research and for the social impact. We represent more than 200 families all around the world, and as a Ring20 we speak more than 6 languages. At for the managing level, there is the board of managers, one representative for each chapter, and there is the scientific board to provide inputs for research and scientific activities with my support, of course. Probably I can't use also for this slide too much time, because it's very easy also for you to understand how is important the role of patient charity, of patient organizations to coordinate the promotion of activities, the awareness for our objectives. So patient organizations are really at the middle of virtuous circles And we are the point of contact for families, clinicians, researchers. We also provide guides for legal and privacy issues. We support social activities. So it's really important the role of a patient advocacy group for promote activities, with the final goal probably to have new tools available soon on the bench, on the bed of our children. This slide is not very updated. I apologize for this, but it's important to have an idea how we spend our money. So about 1/3 of our risk funds have been used for activities directly for the benefit of families and the patients. About 50% goes directly to research, to promote facilities for research that are the biobanking project and a clinical database. I have a couple of slides for these services later. And we support directly scientific research projects through peer review calls for applications. And we promote educational activities through meetings for families and also involved engaged clinicians. So this slide is for the calls that we open to ask, to invite scientists all around the world to provide a new project, a new idea for Ring14. Actually, I forgot to say at the beginning, we care not just for families and the children affected by Ring14, but also to other children affected by other type of rearrangement, chromosomal rearrangement on the 14th chromosome. Okay. So we open calls for applications that that will be subjected to a peer review assessment by our commission, our scientific board, but also with the support of external reviewer to guarantee the best transparency of the process and to find the most appealing candidate to be supported. We usually support a project for 50,000 euro. So these are seeding projects. So we don't have the power to support a larger project. The most important goal for us is to stimulate our scientists to collect the initial results to apply for a larger project to other more impacting funding agency. You can see in the cake the applications we have received so far. About 50% comes from Italy, but there are many other countries quite well represented. And there is the list of the calls we have issued in the last years. And very few days ago, we have appointed a new scientist for the 2022 call. And for this year, we were able to support him with 100,000 euros. So we doubled the budget available for this project. I can't say more regarding this project because we are signing now the final contract with the host institution. So I hope we have the chance in the few months to provide more information. You know that to make new therapies available is the final goal, as we said before, but the research process is very long and is made of a lot of milestones. And those milestones are articles, scientific publications, scientific reports. You can see in these slides the publications and the scientific outputs from our clinicians, from our scientists, supported with our funds. In blue, you can see the article, scientific article published in international scientific journal, and in red, the conference, the output in conference on our meetings. The first year, starting from 2005 to 2006, were just when Ring14 was alone, and from 2014 to 2015 there was the Ring14 International. So you can see the increment of publications starting from the launch of Ring14 International. The majority of our articles have been published in the fields of genetics. You can see in the cake the different fields, and 46% are belonging to genetics, but also psychology, linguistics, and of course epilepsy are very well represented. Okay, I would like here just to introduce the biobanking and the clinical database projects. If we think what are the ingredients, the tools that any scientist needs on his bench, in his laboratory, of course, the first thing is a brilliant idea. Without any idea, the scientist can't be supported on his process. But the idea is not enough to conduct good experiments. The scientist needs to have available biological data and clinical biological samples and the clinical data stored in well-efficient systems. Only if the scientist can use those data and can have available biological samples, he can perform good experiments. So in the left side of the slide, you can see the most important aspects regarding our biobanking project. We have a strong collaboration with a biobank in Italy. This biobank is important not just in the process to collect biological samples, but also to make them available for free for any scientist all around the world. So there is an important collaboration to engage patients, voluntaries that are able to donate DNA, blood, saliva. In the biobank, those samples can be processed to establish cell lines. And all these samples can be browsed on a digital platform. And as I said, any scientist can ask to receive those samples. And so far, there are a lot of scientists who benefit of those data. On the right side, you can see a screenshot of our database. So it's important that both these pillars are available, and would be crucial to link samples and the clinical data stored in the database. The clinical database is already available in several languages, and there is ethical approval, and of course it respects any request by privacy regulation. I would like here to introduce another project. We realized some years ago that clinicians, they didn't have any document able to help them, to support them when they face for the first time children and their parents with Ring14. As a Ring20, Ring14 is very rare, and probably, I was talking before with one of you, is underestimated. So for those reasons, the general practitioner and pediatricians, they are not familiar with our syndromes. So to have a document who can help them for the first level of support when they face patients for the very first time, it was something that was missing at the time. So Ring14 International built a task force of about 15 clinicians and researchers expert on Ring14, and we meet together during a conference, family conference as today, and we started to elaborate the recommendations that we think to provide to other clinicians when they have to care about a patient, a children affected by Ring14. It was a quite long process made of different steps to discuss on the best recommendations and to find a consensus about this task force. After about 2 years of work, we were able to produce a scientific article that was accepted on the Orphanet Journal of Rare Diseases. Probably you know is one of the most important scientific journal for rare diseases. This is the paper, and I just checked that so far there are almost 10,000 of access from all around the world to this paper, so probably we were able to understand, to provide a response to an actual need. Okay. Probably I'm at the last slide, so the time was enough. So I would like here to recapitulate in a single slide several achievements that we were able to collect in the last years. So far we were able to engage 11 scientists, 11 new scientists who never thought about Ring14, and thanks to our support, they start to build some project. And 5 of these 11 scientists are supported directly with our funds. There are, however, other 26 scientists that we didn't have enough money to support them, but however they propose us some new ideas. As I tried to explain before, the objective of a seed grant is to obtain larger funds with the preliminary results obtained with other funds. And 2 positive cases are researchers who were able to obtain a large grant from NIH, and another one from a charity, a big charity, probably the most important charity in Italy. 18 published articles, I already spoken about this. 3 out of these 18 articles are directly authored by us. So Ring14 is the first authorship in those articles. There are other 2 papers in progress that I think will be published soon, probably in 2023, and they are cited more than 200 times. So our papers start to support new other projects. Okay, we presented our data in 7 meetings, 5 on invitation, and a travel grant received. We are collaborating with Eurordis, you know better than me what I'm mentioning it. RDConnect, it was, now is closed, European funded project, and Ring14, we were invited within the core implementation group. So it was a group dedicated to verify the tools developed by RDConnect. And already spoken about the Teleton network of biobanks. We are collaborating in this project also. And thanks with our activity, we obtained that Ring14 received a OMIM code. Actually, I don't know if Ring20, do you have no? I think it's something important to have listed within the database of OMIM, and we received the OMIM very few years ago after a lot of pressure. And so far we have organized 4 meetings for families. I hope that after the pandemic situation we can start again as you to plan another meeting next year. Thank you again for your invitation, and thank you for your patience to listen to me. And you can see here on the left part of the slide the list of the scientists, the clinicians who were seated in the task force for our guidelines, our scientific board, and the board of directors.